I'm Chaco Suzuki with Realself TV, and I'm here with America's top dermatologists, including Dr. Todd Becker. Welcome. Can you tell us what your specialty is and where you practice?
So I practice in Boulder, Colorado. I'm a Mohs surgeon and an aesthetic dermatologist.
Let's talk about Velashape. What do our viewers need to know about Velashape? What does it treat?
Velashape is a fantastic treatment for body contouring. It works by doing tightening of the skin. It does a bit of fat removal as well, but the main effect is really just contouring the body. Really impressive.
And where can it be used on the body? On the neck, on the flanks?
Well, its original approval was for circumferential reduction, so tightening all the way around. But now we've been using it in many different areas. We've been using it on the arms, under the chin, thighs, so a lot of different areas to use it.
And how long has Velashape been around?
Well, it's actually been evolving over the last 8 years or so. So some of the original feedback on it was based on the fact that, gosh, there wasn't enough power. And so as they've increased the power, the subsequent generations have become more and more effective.
Great, and how do you think it's changed the thinking around body contouring in general?
Well, it's really changed the idea that you need surgery to recontour the body. And we can do a lot of things, whether it's removing fat, tightening skin, a lot of things without cutting.
And is this can this kickstart weight loss, or would it be recommended for that?
Well, it doesn't actually cause weight loss. It's a great adjuvant to weight loss. So if somebody is losing weight, it's a great way to tighten up the skin. And post-pregnancy, another great time to do it. And so it doesn't cause weight loss, but it really supplements it and inspires people actually to lose weight.
Oh, that's awesome. And is there a season that it would be best to do something like Velashape? Like, is winter a great time, or summer?
Well, most people are noticing their body in a bikini in the summer, so that's when people start thinking about it, but there's really any time is a good time to do it.
Well, thank you so much, Dr. Becker, for spending some time with us today. And if you would like to know more about him, check out his profile on realself.com. Thanks a lot. We're down in San Diego with America's top dermatologists, including Dr. Jason Emmer. Hello again.
Hi, good to see you.
Could you tell us where you practice and what your specialty is, please?
So I'm in Beverly Hills, and my specialty is surgical and non-surgical body contouring, including liposuction, body sculpting, skin tightening, and cellulite reduction. I do a lot of lasers and fillers as well.
Let's talk about non-surgical, because that's what people really want when it comes down to it. Tell me about Velashape. What is it? What does it treat? And the biggest question, does it work?
It's a good question. There's a lot of devices on the market that are used for non-surgical body contouring. Velashape specifically is a component of 3 different things. One is radio frequency, the other is infrared, the other is massage or external manipulation of the skin. And those 3 together, it's only a device that really pretty much uses those 3 together, can give you both superficial and deep heating of the tissue, but also relaxation of the tissue, which is what happens when you have cellulite, for example. The skin gets pulled down, there's fibrous bands that are there. You need that manipulation of the tissue to be able to release those bands. So it's nice that Velashape has the ability to tighten the skin with the heat that's supplied on the top, to remove fat because there's heat that's released into the fat, and also sort of break apart these fibrous bands so you get improvement in cellulite. Now the question is really, does this work? Because there's a lot of devices that are out there. I will tell you, I have a big liposuction practice. I do a lot of surgical manipulation of the skin and of the fat, and I find that alone it works really well, but even in combination with liposuction or other procedure, it works even better. So the best candidates are ones that have just little bits, little area, localized areas of either skin wrinkling or cellulite or a little bit of fat that's there. The biggest issue is that it has to be done right. You have to go to somebody that knows the technique, that can do it for the right amount of time and get it to the temperature that it needs to, so that the fat is removed and that the skin gets tightened, but it does really work.
When we're talking about heat and temperatures, I think people get a little bit worried about what are the risks. Are you going to damage my skin? Am I going to get burned?
So my patients always say that this is like their hot stone massage. When they come to the office, we lower the lights, put some music on, and we do the Velashape, and they almost fall asleep because it's that comfortable. There is the ability with any of these devices, especially ones that are radio frequency or infrared, because the energy is building up in the skin, and if it gets too high, it can cause you to get a burn. So there is that risk, but somebody, again, who knows how to do it, who does the right technique, can get that to be almost no risk. I have yet to ever have a burn. We're very, very careful. We monitor the skin temperatures, but when it's done right, the risk is almost nothing.
And how is heating the fat different than cooling the fat? Is there an advantage?
All the devices work. The question is, how do they work? In this case, the heating causes the fat cells basically to burst apart, and then the body goes in and removes them. So you see a result, but it takes a little bit of time. In the case of cooling, the fat cells die, they freeze, and then the body defrosts them and basically dissolves them. So it's just a different mechanism. With heat, I believe that you get a little bit more skin tightening because the heat that's released causes the lower part of the skin to sort of activate and produce new collagen, which then tightens. With cooling, you really are just killing the cells, and then the body is sort of shrinking down, but it's not really offering a new collagen.
Have you used Velashape yourself?
So I have, and before I even got it, I made them do it on me a few times, and then what ended up happening was I liked it so much that I tried to do it myself. I couldn't do it, so I had to teach other people how to do it, so I knew I had to get it. And I also did my best friends who told me that I had to get it because it works so well.
What is the downtime with this? Is this something I can come in and skip out of your office and go back to my life?
You can. You'll feel a little bit warm and have some redness there for about an hour. There's a couple protocols. The main one that we do is you come in for 3 20 to 30 minute sessions spaced 2 weeks apart, and you can get probably about a 1 to 2 size change at that point. Now with cellulite, it's a little bit different because we're manipulating the tissue, especially the fibrous bands that pull the skin down. That takes more treatments, but I tell people you got to do at least 3. You go for the 3 that's spaced 2 weeks apart for 20 minutes, and then maintain after that. Maybe once every 3 months, maybe once every year. It just depends on the individual case.
And last question, how fast will I see results?
Within 2 weeks, I'm doing the treatment. I did have a patient the other day who I did her legs for skin tightening and knee wrinkles. When she stood up, nothing fell down. So she was impressed. She was 63. She said she's going to be coming every week for it.
That's amazing. Thank you so much for sharing that information on Velashape, Dr. Emmer. And if you would like to learn more about him, you can look him up, Dr. Jason Emmer, on Realself.com.